Well, good afternoon and welcome to Voices of Faith Transforming the Community. The mission of the Saginaw African American Pastors, better known as SAP in the greater Saginaw community region, is that we are a Christian faith-based group designed to address what we call key issues that impact our community on all levels with faith, strength, and boldness in order to ensure that we have a healthier community. We certainly believe in that. We endorse that. So what do? We advocate, we collaborate, and we engage in intentional conversations with the whole point being that we want you to be empowered as a community. We want to be able to connect with individuals that can make your life better and make our city better. I'm your host again, and let me just say I'm glad to be back. Dr. Craig Tatum, I'll serve as your host today. I serve as pastor for New Life Baptist Ministries, and I am a member of SAP. I'm going to be your host today, and today's episode is probably one of the greatest episodes that I'll have the privilege to do. It's a special one because we're joined today by one of what I call Saginaw's superheroes, a good friend, an impact agent that is making Saginaw better one person at a time. In the person, ladies and gentlemen, Dr. Brenda M. Coughlin, MD, President and CEO of Great Lakes Bay Health Centers, better known as GLBHC. So let's take a minute to welcome her to our broadcast on the day. Dr. Coughlin, welcome. We're glad to have you today.
Well, thank you so much, Pastor Tatum, for having me. I am so excited to share what Great Lakes Bay Health Centers does and the impact that we are working to have on our community. Changing lives because we care.
Amen. Now, in case you didn't hear me, let me say it again. Not only is Dr. Coughlin a dedicated physician, but also, listen, a leader in advancing healthcare access in communities around Michigan. And let me go a step further and just brag a little bit. I'm privileged to sit on the board working with her. And we believe and know by, again, data that we have the greatest healthcare system in the state of Michigan. And I'd go further, but I'm going to stay right there. She can brag a little bit, but I'm grateful again to sit with her and begin to make a difference in the lives of individuals. So Dr. Coughlin, let's start with your journey. You're both a physician, and now you're the CEO of a major federally qualified health center. What inspired your transition from clinical care to health care leadership?
Well, thank you for the question. Let me start by saying I did not become a doctor because I wanted to be an administrator.
I got you.
I became a doctor because I love taking care of patients. I've had a wonderful opportunity since growing up in the Great Lakes Bay region and going to medical school and coming back and residency, a wonderful opportunity to see so much need in our patients all over the United States. I've seen people who can't get care because they're uninsured. They can't get medications. People who don't get listened to when they go to a specialist. And so their problems, their issues aren't dealt with in a timely, appropriate manner. And through all of the time that I've spent at Great Lakes Bay Health Centers, I've been there. I've been a physician for 30 years. I've been at Great Lakes for 27 years.
Wow.
And through all of that time, I have seen a lot of decisions made that I didn't think were the best decisions for patients or for the medical providers. So I became an administrator because I wanted to be the one making the decisions that I thought were best for our patients and best for our providers, so we could really provide the best possible care in the given circumstance to really care for people, change lives, and make a difference in our community, because we have such potential at Great Lakes Bay Health Centers to change our community. We can change the environment. We can make it a more loving place. One of my goals is always to create an environment where everyone walking in the door, no matter who it is, if it's a patient, an employee, a guest, a salesperson, I don't care who it is, when you walk in our door, that environment we want everyone to feel loved, respected, cared about, and listened to. Excellent. That is the environment we seek.
Now, Dr. Coughlin, I said this earlier, and it may have just went over people's head. I said that you are the CEO of a major federally qualified health center. So can you explain what that is and how Great Lakes Bay Health Centers fits into that framework?
Absolutely. I am excited to explain that because federally qualified health centers exist all over the United States. There are about 1,500 of them. And the reason it is so important is we are safety net providers.
Okay.
So anyone everyone knows someone who needs our services.
Right.
Everyone knows someone who doesn't have insurance, who is having trouble getting care, who can't get what they need to be taken care of.
Mhm.
And this is available all over the United States.
Wow.
You can look it up on the internet to find, so if you have a relative in Tennessee and they need care, you can look it up on the internet and find the closest federally qualified health center where they can get help. So let me explain what a federally qualified health center is. What we do is we provide excellent health care to people who come to us. Any Great Lakes Bay Health Centers will take care of anyone who comes to us.
Now stop, Doc Cock. I want to make sure you say that again, because I don't want anybody to have any excuses as to why you're sitting out there and you got these stiffos, you got this going on. I need them to hear that again. So say that again for us.
Great Lakes Bay Health Centers will provide health care to anyone who comes to us. Anyone who comes to us.
Anyone, Saginaw Bay City. Anyone. I need you to make sure you get that. Go ahead, continue.
And please come if you need care, because that is why we are here. We are here to help you.
Excellent.
So federally qualified health centers have several requirements that surround them that have to be part of who we are to be able to provide the services that we do. We have to be working in an underserved area.
Okay.
So we work very hard to be able to provide excellent services to people who are uninsured, underinsured, or underserved. But there are many places in Saginaw and in our region that are health professional shortage areas.
Wow.
There are not enough doctors, not enough dentists, not enough behavioral health providers, not enough counselors, not enough psychiatrists. So if you look at the statistics in our area, especially in dental and in behavioral health, the need is much greater than the number of medical, dental, and behavioral health providers available.
Wow.
So that is the role of community health centers. We fill that niche. We're safety net providers. We help to take care of people when there just isn't enough care available, or populations that really struggle to get good care.
Okay.
One of the populations that we take care of is HIV positive people. And with HIV, now you can basically, we have undetectable viral levels, not be able to give it to anyone else, and live a normal life expectancy.
Excellent.
If you're well cared for, and we can fill that niche. So it's really exciting. But as a federally qualified health center, there are several things that we have to do. We have to have be community directed.
Okay.
So our board of directors has to be at least 50% patients.
Wow.
So
excellent.
Our patients in our communities tell us what they need, and we have to be responsive to that, which I think makes us unique and really helps us to be a little bit agile to whatever is the biggest need in the community. We're required to have quality assurance programs. So we have to be focused on, are our patients getting the best care? Are they getting their diabetes taken care of? Is their hypertension there? We also look at everything based on different population groups to make sure that it's equal.
Okay.
No matter who you are walking in the door, you should be getting excellent care. And we do everything we can to make that care accessible to everyone. Excellent. And equal for everyone. And sometimes that looks different for different populations. 3% of our patients, 3%, English is not the best language for them to be receiving their medical care in. Right. So that patient population, we provide translation services for. There are patients who have trouble getting to us. We provide transportation. We have vans. We provide bus ticket tokens. That's part of what we do as a community health center. We're required to do a set of enabling services. We have to do interpretation. We have to do transportation. Wow. We do care management. We have community health workers. We have this whole set of services that surround our patients so that they can get the care that they need. We're required to provide a sliding fee scale. Okay. So for anyone who is under 200% of the federal poverty level, we have to provide discounted services. So if they don't have insurance, if you are under 100% of the federal poverty level, your medical visit is $10. Wow. No matter what we do. And we have done $10 hysterectomies. That's what it costs. That's what it costs. And for dental visits, $40 for a dental visit if you're under 100% of the federal poverty level. For glasses, you can get a pair of glasses for $45. Wow.
This is phenomenal. And let me put it in a phrase I hope people can understand. So Great Lakes Bay Health Centers is kind of a one-stop shop type of situation. And I want you to just elaborate. Let's talk about the care you do provide. I mean, you've kind of given us a snippet of it, but let's talk about the services you do provide. We see the vans. I see them all across the city. And so let's talk about some of the services that Great Lakes Bay Health Centers does provide. Can you talk a little bit about that?
Absolutely. Community health centers are required to provide comprehensive services.
Okay.
So we have to provide primary care. We have to provide dental services, behavioral health services as part of what we do. We do vision services with our optometrists. So we have a lot of basic services. We also provide pharmacy services.
Okay.
We're able to have discounted medications that we can purchase as a community health center. We can pass those discounts on to our patients. So when I'm taking care of someone who is uninsured and below the federal poverty level, I can take very good care of hypertension and diabetes with $4 medicines.
Wow.
I can keep them under control. I can keep them healthy. It makes a huge difference. We do psychiatry, counseling services, pediatrics, women's health. We do OB-GYN. We do over 500 deliveries, or did over 500 deliveries last year. So we have some x-ray and laboratory services. We do phlebotomy. We draw labs at all of our primary care sites because transportation is the biggest barrier for our patients.
I got you.
And so if you have trouble getting to the lab, if I draw it while you're in the building, we don't have to worry about getting those labs.
Excellent. Now, and just so people are aware, during this past several years and helping time-wise, I know that there's been a presence at the high school level.
Yes.
In the high schools.
Yes.
And in case Saginaw is not aware, just in the last several years, a new center opened up on Court Street.
Yes.
And we've got another one that's brewing. I don't know if you want to talk about that. We'll get to that. But let's talk about specialized services. Are there any specialized services that might surprise people, perhaps programs for agriculture workers, substance use treatment, or mobile clinics? Talk a little bit about that.
We have a lot of specialized services. And just to make it clear, all of these grow out of needs in the community.
Excellent.
So we partner with what there is in the community. If we can find it, we're not creating it. But when we can't find it for our patients, we partner with people to make it happen. So we have Great Lakes Bay Health Center started as a migrant health center. So we still provide care to migrant in 1968. So we still provide care to our migrant and seasonal farm workers. And we do that largely via mobile units. So we have a mobile medical unit that travels to farms throughout the state to keep our agricultural workers healthy, because Michigan is the second most diverse agricultural state in the United States. And our agriculture, our farm products are a huge source of income for Michigan.
Excellent.
And let me tell you, I really appreciate the work that our agricultural workers do. I love the blueberries and the strawberries and the apples. And that is all part of that work that comes out of our patients. So we do that. We have substance use disorder, medication-assisted therapy for people who have problems with opioid addiction. We provide the vision services. We have hepatitis C treatment, which I have to say I am so proud of, because we have 3 of the highest providers of hepatitis C treatment, the most people that have been cured of hepatitis C for Medicaid in the state of Michigan.
Wow.
3 of them. So we are curing people who have a disease that's chronic. We provide physical therapy services. So our patients who are struggling with pain, with mobility issues, we can help them there. We also have alternative pain management with some osteopathic manipulation.
Okay.
So if you have pain, we can try to manage that without opioids. We have the transportation services we've mentioned, with 11 transportation vans that drive around our area and take our patients to and from. We provide the HIV treatment and prevention services. We have mobile dental that goes to our schools. So we have over 5,000 children who, during the last school year, received dental cleanings and screenings on our dental buses at schools. And we have nutrition services, health insurance enrollment services, community health workers who help people with everything that is not medical that surrounds their healthcare. So we help people find homes, we help them find jobs, we help them get books to read to their kids. We help them with that utility bill that they couldn't cover, with the house that has a hole in the roof that they just can't figure out how to do that. We connect them with resources to help take care of those things. And then one piece that is relatively new that I am super excited about is we have doulas who provide support during pregnancy and delivery. We also have women, infant, and children WIC services, which is food stamps and nutrition services and breastfeeding help for women who are pregnant, for kids in the first 5 years of life, and maternal infant health program, which also helps women during pregnancy and after delivery to make sure those moms and the babies are healthy. And the doula services, I am so excited. It's new, but it has the opportunity, it has the potential to decrease the infant mortality rate and the maternal mortality and morbidity rate in Saginaw. And those numbers I've been fighting for 25 years.
Wow.
So I am excited.
Well, you've given us a volume of information, and I can tell that you're, as we would say, peacock proud of the great work that's going on, and I support that as a board member, but also seeing the great work. So I have to ask the question: just how many locations does Great Lake Bay Health Centers currently operate, and what regions of Michigan do you currently serve? Because most people may not know that.
Absolutely. We have 33 health center sites. 33 sites.
That's phenomenal.
And it covers an area of 16 counties.
Wow.
So the Great Lakes Bay region and beyond, we are all of the thumb. And then the Great Lakes Bay region, we go down to Shiawassee, Washtenaw, and up to Aranac. So we go over to Belding. We have a migrant site in Belding. So the sites, if you look at them kind of in groups, we have, and this is a service I didn't talk about, we have 4 integrated care sites. So we have 4 sites that work inside of community mental health facilities.
Excellent.
And the purpose there is people who have severe and persistent mental illness have a 20-year shorter life expectancy than you and I do.
Wow.
So if we go inside of the facility where those people are comfortable and where they get services, we feel that in collaboration with CMH, we will be able to impact those numbers.
Excellent.
That's why we're there. So we're inside of Saginaw Community Mental Health, Shiawassee, Midland, and Huron. We have 6 school-based sites.
Wow.
So we have, and this is very exciting because it's new in Saginaw, right? Is it right? Saginaw United High School.
Yes.
And Saginaw Arts and Sciences Academy. We have community health centers inside of those. We have a center inside of Bay City Central High School. And then we have behavioral health sites inside of Thompson Middle School, Bridgeport High School, and Washington Elementary in Bay City.
Wow.
So those are our 6 school-based centers. We have 7 mobile units, 4 dental, 2 medical, and 1 vision. The vision is new, so it's going to be going to schools in the fall. Very exciting. And that is very exciting because we learned that there are hundreds of children in Saginaw County who get screened in the school for vision. They find that their vision is impaired, that they're not able to see well, and they never make it to the eye doctor to consider whether they need glasses.
Wow. Well, given this volume of information, again, I just say it's massive because you're considered the #1 healthcare center in the state of Michigan. And that's just gradually happened over years. So I got to ask the question, just how many patients are served by Great Lakes Bay Health Centers? Right. General idea.
So we are the largest community health center in Michigan. I'm very proud of that, considering that it's Saginaw and we are not the largest city in Michigan. But we've had so many opportunities, and I'm really humbled and proud that we can be the person.
Understood.
We can be the place where our patients trust and are willing to come for medical care. So last year and for the last several years, we've seen about 56,000 people.
Wow.
That we've taken care of with about 250,000 visits last year.
My goodness. That's phenomenal.
So then just to finish our sites, we have primary care in Imlay City, Shiawassee, Thumb, and Belding for our migrant patients. 3 sites in Bay City South, which is largely behavioral health, Bayside, and which is medical and dental, women's care, Bay City, which is our OB-GYN. And then in Saginaw, we have 6 sites, primary care, Bridgeport, Davenport, the Gomez Center, Old Town, Jane Street, Ruffin. We have 1 purely dental site in Saginaw, Warren. And then we have Hearth Home, which is an HIV prevention and support center with testing and community education. And then finally, we're at TRICAP, which is a justice-involved population.
Right.
Which is also, I tell you, a very high need. People who just came out of jail or prison really need support to help them to be healthy enough and able to then engage in work and get back into the community.
Excellent. I hope that our listening audience has a better understanding. And quite frankly, this interview doesn't do justice. One of the best things that I would encourage individuals to do is just go in, take a tour. There are tours being offered all the time. For those of you that are listening that have healthcare and all the above, we'll hit this later on. We're getting ready to take a break right now, but you can be a great supporter of this. And I want to echo that. Several times a year, there are opportunities for people to support. You don't have to wait till those opportunities. You can give now. And Dr. Cogden will share that towards the end of the broadcast. I'm teasing you because I want you to stay. We've just began to open up all of the great wonders that are going on. I want to talk a little bit more about access to healthcare. There's some other things. Stay tuned. We're going to come back here in just a minute. to bring you more information to empower our community. There's a phrase I say, when the community is healthy, the city is healthy. And so we want to make sure that happens. We don't want you to leave without having an opportunity to know that I can walk in. I'm not going to be refused. I'm going to get health care. It comes at a very minuscule price, depending on, again, your financial ability. But we want everyone to be healthy, men and women. All right. So stay tuned. We'll be back in just a couple minutes. All right, we are back. And again, I'm talking one of Saginaw's, the region's superheroes, in the person of Dr. Brenda M. Coughlin, MD, President and CEO of Great Lakes Bay Health Centers, affectionately known as GLBHC. And let me throw another plug in. As CEO for Mission in the City, I am eternally grateful to she and her husband and family for being great supporters of Mission in the City. Matter of fact, if you drive by Mission in the City, the Dr. Rufus Bradley Senior Mission in the City Park, you'll see this great canopy there where we've got this huge chess court. Again, we thank them for being great supporters and making that happen. They're sowing seeds. They believe in helping. That's just the nature. That's the heart. I want people to really understand that. So we're back talking about, again, Great Lakes Bay Health Centers, which is the greatest health center in the state of Michigan. And I'm going to be bold right now as a board member also and say probably in the country, because of the great leadership, the great staff. I listen to the stories every board meeting about people that have been helped. Some of our board members are, again, patients. It's amazing to me to hear the tremendous stories of how we've helped people, either on the board or in our community. Dr. Coughlin talked about the eye care piece, and one of the doctors came in and shared about a young lady that was having some challenges and how her interaction and interfacing with Great Lakes Bay Health Centers changed her ability to perform in the classroom. And that tells you how they will go the extra yards to make sure that lives are changed. So we're back talking to her, and we know, Dr. Coughlin, that healthcare, or rather access, is a huge issue for many Michigan communities. So what are some of the key barriers, and kind of give us an idea, again, some of the people that we serve, but what are some of the key barriers to care that Great Lakes Bay Health Centers helps patients overcome?
Thank you for that question. The biggest barrier to care that our patients have is transportation.
Okay.
So we provide the 11 vans that will transport people. We give people bus tickets. We provide telehealth visits when people can't get to the center.
Mm-hmm.
We take mobile units to facilities or places where people aren't able to get in. So we're at the schools providing the dental care to the students so they can get the dental care, or we go to the recovery site to be able to take care of that patient population there. So we do a lot of that. I think one of the biggest barriers, there are a couple other huge barriers. One is that 27% of our patients don't have insurance.
Wow. And
just affording to come into the doctor, when you don't have insurance, you don't come as often. You wait until you're sick before you come. And that really has a lot of poor outcomes. So 27% of our patients are uninsured. 39% have Medicaid, which is a great insurance to allow us to get most things for our patients, but still there are limitations based on referrals. Some people don't take Medicaid, so that's a barrier sometimes. One of the other large barriers is that people often feel discounted and not heard when they go to the medical system. And if you run into that multiple times, you quit trying. So just creating a place where people feel like they're actually cared for. We are glad you're here, and we're going to partner with you to try to improve your health and get you to a better spot. That is a huge thing that we try to create. And when you look at our statistics, 89% of our patients who tell us how much money they make, there's a section of them who won't give us indications of but of the people that we know their income, 89% live below the 200% of the federal poverty level. So there aren't a lot of resources. They have a lot of challenges. 12% of our patients identify as Hispanic or Latino. 27% identify as Black or African American. 700 patients are migrant or agricultural, seasonal agricultural workers. 28% of our patients are less than 20 years old. So we take care of a lot of children.
Interesting.
Yes. And 12% are over 65, which I have to say I'm really excited about, because when I started working at Great Lakes Bay Health Centers back in 1998, we maybe 4% were over 65. I think that the life expectancy of our patient population has grown. I think people are living longer because they're healthier, and that's very exciting and important to me. I already talked about the people best served in another language that we provide translation services as necessary. And then one of the big things for our patients, if you have trouble getting your medications, we have pharmacies that provide discounted medications for people who don't have insurance. So we have a pharmacy at our Jane Street location, our Old Town location, and at our Bay City South location. So if you, we've had people who come in who, one lady came in, her mom was on Medicare, and she came in and she was, she had many medications, and she was never able to afford them all. So they had to figure out which medications she could get for her mom. And when she came into our pharmacy, she started crying. She said, I can at your pharmacy, I can afford all of these medications.
That's excellent.
So that was huge. We also provide the discount. We have discounted mammograms. So if you don't have insurance, we can get you a mammogram and make sure that you don't catch breast cancer early. I have a patient who was working 2 jobs, but no insurance. And she, for years, I kept saying, get a mammogram, and she wouldn't do it. Finally, we got her a $15 mammogram. Mammogram was abnormal. Got her to a local hospital who was able to arrange for breast biopsy, breast cancer, got her into emergency Medicaid, got her a mastectomy, cured, didn't have to have chemotherapy, didn't have to have radiation because we caught it early enough. She calls us her angels because she says she's alive because of us.
Well, and I want people to understand that's not the first person. You hear that so often. And I think you mentioned something I think Saginaw needs to understand, and that is the whole idea that when you walk into Great Lakes Bay Health Centers, you're going to be amazed at the fact that from the minute you walk in till you leave, you're going to say, people heard me. I think that's critical for people to understand. They heard me and they care. You're not discounted. You matter. Going into some of the what we call the rural areas, giving people access there. And then a key word that you talked about earlier was helping people who are uninsured or underinsured. Can you talk a little bit about that? And you can mix all this in. I'm thinking, because you mentioned a lot of things, so I'm gonna throw in sliding fee scale, outreach patients, and Medicaid enrollment. So talk a little bit about all of those, because I think people, hopefully you're taking notes, will listen so they can see, hey, there's a program, there's a way I can get help. My grandmother needs this, my son needs it, my hard-headed husband who won't get care, he needs it. I think men, we need to be listening so that we can do this. So talk a little bit about all of the above.
Absolutely. Thank you for that opportunity.
All right.
It's a great question. So for our uninsured patients, generally, we try to make sure that every uninsured patient gets to speak with a community health worker. And that person can evaluate their eligibility for any insurance, any extra aid to help them to be able to not have to pay for all the medical care out of pocket. If we can't find anything to help them with, sliding fee scale is based on your family size and your income. So if you are right now, if you're a family of 4, you're at the federal poverty level with $15,000 with $32,000
Okay.
of income. Family of four, 32,000 federal poverty level. We have discounts up to 200% of the federal poverty level, so
Wow.
64,000 for a family of four. If you're a single person, it's 15,000 for the federal poverty level, 31,000 for our sliding fee scale.
Okay.
So that makes a huge difference because $10 for a medical visit is something most people can come up with $10.
Excellent.
And I got to tell you, if you walk into our site and you need to be seen, even if you have no money, you will be seen. If you need to be seen, if you walk in, you will be evaluated by a nurse and we'll determine whether you have a condition that needs to be evaluated immediately.
Excellent.
And we will take care of you if you need that. I'm not sending anyone away who is in a bad place and needs to be taken care of. So the sliding fee scale, $40 for dental, $45 for glasses, $10 for medical. Then we have the discounted pharmacy. So all of your medications, we have a significant $4 list. We can get you medications pretty well. The mammograms, x-rays are discounted. Transportation is part of our package. You don't pay any extra for that. Care management nurses keep up with our chronically ill patients to help them to stay on task. So diabetes, hypertension, they're making sure that our patients are getting their medications. They're able to take them. They're able to get what they need to be healthy.
Excellent.
Our community health workers help for underinsured. Also, our community health workers help negotiate the medical system.
Okay.
Our medical system in the United States is not easy to make its way through.
Wow.
I'm sure you and every other person listening to this realizes this, because anytime you have a medical problem and you try to interface with the medical system, it isn't easy.
Of course not.
Even with insurance, you can't figure out how to get from where you are to where you need to go. So we have staff that will help with that.
Okay.
And our doulas help our pregnant women to negotiate how do I interact with the medical system, which most of us are not familiar with.
Right.
So now you're in the hospital, you're in labor, and you don't understand what the medical people are looking at and what they're caring about. You're understanding what's important to you.
Right.
And those doulas help to bridge that gap so the care providers can understand what the patient wants and how it's affecting them. And then the patient can understand what the medical providers are saying, because that is a huge gap in a lot of our medical care. So excited about that. And our community health workers then help with food and work and bills and whatever needs to be helped with to get you to a good spot.
Everything.
One-stop shop.
Now talk a little bit, and I'm gonna jump off the train for a second. I want to come back to doulas. Talk a little bit about that. When the program first started, we were privileged. I want to say it's about a year or so now, to have one of the, I think Miss Williams and crew were, I think, our first interview, I believe. I have to go back and check. I think they really were. Program was just getting up and jumping. But since then, how many babies have been delivered? Tell us a little bit about the doulas program so people understand it.
So the doula program is a really exciting program for me. We train people they start out generally as lay people, not with a lot of medical experience or training. Some of them have some, but not all of them. And we train them about the pregnancy process, the delivery process, and how to interact. They're not medical staff. They're not assisting with the delivery. They're the support.
Gotcha.
They support pregnant women. They help them to understand what to do to be as healthy as they can, to have healthy babies, to interact with the medical system in a way that will give them the best opportunity for a healthy mom and a healthy baby. They stay with them during delivery so they can provide labor coaching.
Gotcha.
They can provide help just to understand after you have your baby, how do you interact at home?
Right.
Are you having any problems? Sometimes after delivery, people experience things that are unhealthy or scary, but you don't know.
Right.
You don't know what's normal. You don't know if it's okay. And if you talk to our doula, they can sometimes direct you and they can say, no, that is not okay. You go to the emergency room.
Okay.
That is dangerous.
Excellent.
Or, you're having a little bit of baby blues. We can talk through that. We'll try to help you with that. If it doesn't work, we're going to get you to help.
Excellent.
So that doula program has already, in the statistics we've been looking at, made a difference in our birth weight. So we don't have as many low birth weight babies.
Okay.
We have more babies that are making it to term. We've already had some good statistics out of it. It's early in the program. We started, it's been a little over a year. So, but I am very excited because our in Saginaw, more than 1.5% of our Black babies die in the first year of life. And that is an unacceptable statistic to me, and I think to everyone else.
Wow.
So we're going to change that number.
There you go. We're working at it. We're working at it. Talk a little bit about So person comes in that may be uninsured. Are they a candidate for Medicaid enrollment assistance? What does that mean? We talk about that. And then I want to jump into, because I know we got just a couple minutes left. A critical part of what you've been doing now involves this new piece called telehealth. So I want to talk a little bit about how that plays into Great Lakes Bay health centers, especially after the pandemic. So talk a little bit about that.
Okay. So let me talk about telehealth first.
Okay.
So telehealth during the pandemic was a critical opportunity for us to be able to keep in touch with patients and keep them healthy. So if you were sick, you didn't have to come into the health center to make other people sick. We could take care of you over the phone.
Okay.
Or if you were well but high risk, you didn't have to come into the health center to potentially get exposed.
Excellent.
So during the pandemic, it was huge. Since the pandemic, as we're more comfortable getting out, people have some immunity. People aren't getting as sick from COVID. Wonderful. Not nearly as many people dying, though it just went out of the top 10 reasons of the people just started dropping in the number of people dying from COVID recently. But in any case, since the pandemic, what we've found is that this telehealth provides an access for people who don't have transportation.
Okay.
If you can't get to your appointment, you had an appointment today, but your sister who was going to drive you all of a sudden had an emergency, couldn't come. We can switch that to a telehealth visit.
Okay.
And I can still manage your diabetes.
Excellent.
I can still take care of your hypertension. If you're sick, you can call and we can talk to you and we can manage the illness. Or if we need to say, like, you need to come in because we have to see you. But sometimes you can manage it over the phone. Sometimes you can just take care of people that way. The primary area that our telehealth is being utilized right now is in behavioral health. So a lot of patients for psychiatry and for counseling, they often have, for instance, counseling. That can be something you do every week.
Okay.
If you're working and you have to drive to an office, wait in the waiting room, get into the office, do an hour of counseling, drive back to work, that takes you out of work for a significant amount of time.
Yes.
But if you can say, I'm going to work, and then when it's time for my appointment, I clock out of my job, I can go to my car for an hour, talk to my counselor, come back, clock in, you can manage to put it in among your workday without causing significant problems with your income. So it has really been critical there. So we are still seeing about 24,000 virtual visits a year.
My goodness.
And I got to tell you, it's amazing. I had a patient when I was working out, I was working at one of our sites, and I had a patient who'd been in the office earlier in the week, had pneumonia, and was given medications, but was not getting better. So it's Friday afternoon, 4:30.
Okay.
And he calls the nurse and he says, I'm still having shortness of breath. I'm still coughing a lot. And the nurse came to me and she said, this gentleman is having all these problems. It's like 4:30 on Friday. There's no way he can get to the office by 5, and we got to close because our staff needs to go home to their families.
Right.
And then all of a sudden it occurred to her, let's televisit.
Okay.
So she calls him up, hooks him up with me, and we were able to talk through, figure out what to do, change the medications, and get him so that by Monday he was already starting to do better.
Excellent.
So that is a great use of telehealth, just to take care of some of those things that don't require you to be in the office, but they're critical visits.
Gotcha. As I would say, this is phenomenal information. I trust that everybody's listening have been taking notes. You now know that you can help family members, maybe even you yourself have never known what's all engaged and involved. So now you know you can walk in that door. You will be tended to. They will assess you. They will do what's best for you. They do care. They really want you to be healthy. And we know that, again, a lot of this has to do with Medicaid and funding. And I know we just got like a couple minutes left, but I want to ask a question before we get ready to just kind of close out. How important is Medicaid to the operations of Great Lake Bay healthcare centers in Michigan? How important is it to what you do?
Medicaid is a very important tool for us to be able to provide excellent healthcare to our patients. So about 40% of our patients have Medicaid. And without that Medicaid, we could not always get them the medications and the specialty care and the studies that they need to keep them healthy to do the best that we can for them. So 40% of our patients have Medicaid. 50% of our funding comes from Medicaid.
Wow.
So it's very critical for us to be able to provide all the services that we do. I do want to just touch really quickly on the insurance piece, because you had asked me about what do you do if you're uninsured. So we have community health workers who are all trained to help with looking at insurance to see if you qualify for Medicaid, if you qualify for the health insurance marketplace, and they can
Mhm.
talk you through that and help you to apply. So if anyone is interested in that, you don't have to be a patient to talk to get the help with looking at the insurance.
Okay.
That phone number is 989-921-5353. And a
Excellent.
community health worker will get back with you and they can help walk you through that.
Now, I want to throw these two because we got less than 3 or 4 minutes. I know as a board member that in part of our dialogue at meetings, you've indicated that, again, there's always a need for employees. And I know you're always looking. So tell the audience if they have an interest, what they can do. I know there's criteria. I get all that, but just let people know that there is a need. So talk a little bit about that. We got less than about a minute or two to go, and we'll close ourselves out.
We have a huge need for people who are willing to do this work, especially people who have a heart for it.
Okay.
Because we're here to change lives. And if you're not walking in the door because you want to change lives, probably not going to be a good cultural fit.
Excellent.
But we have a huge need for dental care, for
Okay.
dental assistants, dental hygienists, dentists, front desk people. We have hundreds of people waiting on waiting lists to see actually, we have thousands of people waiting on waiting lists to see dentists. So that is a huge need for us. Behavioral health counselors. We don't have enough counselors. There's a big behavioral health crisis in our community, in our country, a lot of anxiety and depression. And we need counselors who are willing to sit and help our patients to work their way through it and get to a better place in their lives. So if you go to our website, you can look at the available open positions and apply there. We have a lot of other openings too. So please, if you have any interest in being involved in this mission, take a look at our website and see if you fit in or how you fit in. You can always fit in.
There you go. We don't have enough time. So somewhere along the road, we're going to do a part 2 at some point. But can you again share a contact number, a website, Facebook page that people can go to if they want to find out information? You've told us that there are a plethora of buildings right here in our city people can go to, but if you got the website, Facebook page, and a phone number that people can go to so if they can get more information.
Absolutely. So website, www.greatlakesbayhealthcenters.org.
Okay.
Facebook is www.facebook.com/Great Lakes Bay Health. If you are interested in getting more information or making an appointment as a patient, our phone number is 989-921-5377. We are accepting Medicaid, uninsured, and anyone else who would like to come to us for care. We do have also, we are on Instagram and LinkedIn. So you can look us up there also.
Well, we are out of time. I had more questions. I have to tell you, I just couldn't get through all of them because it's some vital information. But I want to again say thank you, Dr. Coughlin, for joining us today. It's clear to me as a board member, as one that sees the great work, that Great Lakes Bay Health Centers is playing a critical role in improving health and equity in our community. And so, again, I want to salute you, the leadership team that's doing some great work. Let me pause and thank Alpha Media, Kiss 107 for this platform. Again, our great engineer, Mr. Matthew Lester, New Life Baptist Ministry, Saginaw African American pastors for this opportunity. And let me give a thought to close, if you will. Healthcare access isn't just a goal, it's a shared responsibility. Mahatma Gandhi, I think, said, it is health that is real wealth and not pieces of silver and gold. Leigh Hunt said, the groundwork for all happiness is good health. So until next time, let's take care and stay healthy. God bless you. That is our prayer.